AMP2.TV presents Tell Us Your Business, where you're invited on the air to tell us what makes your business stand out in the community. It's important we hear from you to tell us all we need to know about what you do best. Tell Us Your Business uses the latest radio and television production systems, and all shows can be seen on AMP2.TV. If you have a question for our guest, call 888-565-1470. Now, let's get ready as our guest hits the airwaves and informs us about what we need to know on Tell Us Your Business.
Hello. How are you today, Jackie?
I'm doing good, Colleen.
It's really nice to see you.
Very nice to see you.
So I'm Colleen Farron. I'm an occupational therapist, and I'm sitting across the table from a lovely woman whom I've known for years, Jackie Kelly.
Yes.
She and I work for a Medicare home care company. And we'd just like to share some of your time today and tell you a little bit about what we do, and talk to you about why we like the company that we work for so much.
Sounds good.
Yeah.
Yeah.
So how was your day? What did you do today, Jack?
Well, today I went around and visited a lot of accounts and was able to stop in the hospital and see some of our special patients. And I got to actually co-market a little bit today with Lisa, who's also in the room with us.
So we're going to talk to you later.
Yes.
Yeah. So you were out talking to prospective accounts, talking to physicians, talking to nurses, letting them know that Triology Home Health is a Medicare certified home care company, right? And
Yes,
we
I do.
provide services in patients' homes. Those
Absolutely.
patients that get discharged from hospitals, those patients that get discharged from skilled nursing facilities, those patients that go to see their physicians, their wound care clinics, and they may have the need for skilled nurse, physical therapist, speech language therapist, occupational therapist, or a social worker in the home.
Absolutely. And our favorite, occupational
And
therapy.
our favorite, of course, it's always
our
occupational therapy.
Yes.
So let me ask you, when you talk to them, do they say to you, so Jackie, tell us what my patients have to do to qualify for these services? How do you explain that to them?
Well, they do, and they normally ask. A lot of times with Medicare, they don't understand that a patient, there are some qualifications. They do need to be homebound. Yeah. There has to be a skilled service that they'll need. And once we get through the preliminary, a lot of times the confusion gets on the insurance part. A lot of physicians and even hospitals, they don't understand that there are different avenues of our insurance, even with Medicare. So once we explain all of that and we let them know that, a straight Medicare certified patient, we are able to take them and give them certain services for up to 60 days at a time. And that's kind of how I try to ease into it.
I know when I've spent time in the field talking to the physicians, what the question that I get the most is, explain to me what it means to be homebound. And one of the things that I say to them is that it's not room bound, it's not bed bound, it's not chair bound. Medicare is pretty clear. We have to stipulate what assistance the person needs to leave the home. Do they need a device, a walker? Right. Do they need the assistance of a person? Do they need special transportation?
A lot of our patients, they don't realize they can't go to the grocery store or they can go to church. They can do certain activities. But for the most part, it's very taxing. It's a taxing effort for them to get out of the house. And that is one of the criteria.
Right, and infrequent. So those are always good things to make known. The other thing I get questions about, and perhaps you do too, is what does the physician have to do in order to help someone qualify for home care? What do they have to say that the person needs beyond nursing?
Sometimes it depends. The doctor can, first of all, we start out with getting a prescription. We find out what the patient's diagnoses are and to see what services that we can provide at home. Right. And the doctor really needs to be able to document it. He needs to be able to say this is a service that would benefit our patient. And at that point, we go back and forth and figuring out everything that patient will need, whether it's just a nurse coming out to the house or like I like to add, occupational therapy and physical therapy.
Physical therapy.
And lately, I can definitely say the home health aid has been a big help, especially with my patients coming out of rehabs. They're having a little bit of taxing trouble getting in and out of the shower.
Out of the shower, getting dressed.
Getting bathed is becoming a little bit more work, especially when you're recovering from any type of minor surgery, major surgery. sometimes just being in the rehab itself for 2 or 3 weeks, you just forget about all the little steps to make sure that you're safe.
Features.
Yeah.
Right, right. So when the nurse goes to the home, see if this resonates with you. I've generally explained to people that they work on things like medication management, that they can observe and assess the status of someone's disease state, their physical well-being, their insight and knowledge into what they should eat and what they shouldn't eat, how safe it is in the home. And they can do that for multiple weeks at a time. Medicare is real clear, right?
Yes.
We can observe and assess just to make sure that you're the best you can be.
Absolutely.
And now we have Lisa. Hi, Lisa.
Hi, and
How are
I'd
you?
love to add, I'm doing well, thank you,
Good.
that it is covered 100%. So Medicare
very
does
big deal.
cover this
Right.
service
Right.
at 100%.
Right. It is part of the Part A benefit.
Correct.
And if we refresh ourselves, we know that Medicare Part A is hospitalization, skilled services in a facility, as well as home care at 100%. Knock wood, they haven't changed that over all these years because they understand how important it is to keep people in their homes and how much less money it costs, right? A lot
Absolutely.
less money to keep people in their homes, keeps them happy too.
Yes.
So we have nursing. What about physical therapy? How do you explain what physical therapists do?
Well, depending. If a patient needs a special type of therapy, we have a lot of different plans that we have available. So we have lymphedema therapy, fall prevention, strengthening. It just depends on what the patient has as far as their diagnosis. And then we go from there and we do an assessment. So when the start of care begins, they send out the nurse, and also the therapist can do an evaluation and then an assessment treatment.
Right. They're
So-
the physical mobility
They are.
specialists. That's what I always tell people
Oh, I
too.
like that.
Right, the physical mobility
specialist.
specialists.
Absolutely. And
They're
also
responsible.
energy.
Right, energy conservation and good for pain management too. Physical therapists do a lot of manual handwork on patients with their muscles and their joints. They take modalities like
Yes.
ultrasound and electrical stim and infrared units into the home, and they work on the patients that way. I think that what's interesting, because you, of course, are in sales, and I, of course, am in rehab management, and what I find is that occasionally in this service area, people move. They go from their daughters, perhaps here in
Yes.
Broward, but their real home is, say, in Port St. Lucie,
Right.
or it could be in Orlando. And the nice thing about our company is that we cover Florida.
We do.
Don't we?
We
have
do.
offices everywhere.
Every county.
Broward, Palm Beach, all the way up the state through Jacksonville. So the same quality of services can move around. The physical therapist that we love in one office, we can find someone pretty good in another office for them as well.
Absolutely.
And then what about speech language therapy? What do we do with speech therapy?
Well, speech is a lot about swallowing and
Swallowing,
swallowing
big deal,
education,
right.
which is, communication disorders. If a patient has previously had a post-CV and they're having a little bit of slurring or speech.
Right.
And then you like the vital stem
I
therapy.
like the
Is
vital
that your...
stim. That's kind of it's a type of electrical stim, and what happens is that the speech language therapist does a really good evaluation of the swallow and then has a certification course that they go through so they know exactly where to put the little electrodes that come from a small e-stim unit on, and the patient then goes through muscle re-education, and those muscles get stronger so that they can swallow more effectively. Right. A really big deal.
We also have a respiratory therapist.
We do.
Who is
That makes us a little bit different.
a little bit
Doesn't
different.
it?
Yes.
Doesn't it? Respiratory therapists are really good for people that have come out of hospital, right, with some sort of a congestive obstructive pulmonary disease or multiple types of pneumonias. They take aerosolized medication that comes to them through a nebulizer, something that they suck in the medication from. They work really closely with our nurses.
They
We
do.
don't have that too much. Not a covered benefit, but Medicare pays for it because we offer it.
And when you have that patient who's leaving the hospital with oxygen, this is a new thing for them. So it's always good to have that respiratory therapist teach them at the home and make them feel comfort and secure with this new
Right.
Yeah.
equipment.
Right.
It makes
right.
them a lot
it's a very
more
good
confident.
point, Lisa.
Makes them a lot
Makes
more
them really
confident.
much more comfortable. Right.
Absolutely, especially the first time,
Right.
and especially when they have to learn about the tubing, the different oxygenator, and everything coming into the house. It's something
Right.
new, and
Right.
they like
Right.
having that backup.
Right. And we see a fair amount of patients that have depression as well,
Yes.
or have dementia. And so the other thing that our company does, Triology Home Healthcare, that's different than other companies, is that we offer certified psych nurses. And certified psych nurses, unfortunately, they don't grow on trees, do they?
No.
We have to do a lot of recruiting and retention to keep them because there's not very many of them. Medicare has a psychiatric home health benefit for those people that have mental illnesses and dementia. And so we provide those services. That team consists of a social worker,
Yes.
a medical social worker, and an occupational therapist.
Yes.
So that brings up occupational therapy.
Oh, your favorite,
Right?
Colleen.
Only because I've been one forever and a day. Occupational therapists are a really big piece of our team as well because they are the clinicians that work specifically on people's activities. How well, safely, and fast can I get you back to bathing yourself, dressing yourself, making your meals, taking care of all your activities in the home, including some really important things like pet care.
Yes.
We always have to talk about that because a lot of people have very small animals that they care for. And it's not easy bending over and changing kitty litter and taking dogs for walks and all those things. So we look at the big picture as occupational therapists.
And also, it does help with the readmissions back in the hospitals.
It's a really big
so
deal,
it's
isn't it?
I know that's one of
I
our.
love that you reminded me of that.
Yes.
Occupational therapists of 19 spending categories, over 7,200 hospitals, a national study was done, and it was the one spending category that reduced hospital readmissions, getting an occupational therapist in on the case before we put people in home again. Yeah, it was a really big deal. So we have to remember that. And then we have social workers. And they're pretty awesome, too, because the social workers are there to help with any sort of transition, community resources, any state, county, or federal funding that might be available for people. And they also help us with transitions if someone needs maybe to move to an assisted living or an independent living facility.
They're actually a key part of that.
They're a big piece of
They
that.
help with all the planning. They
They
help
are.
locating the facilities or the communities and trying to be a good match, trying to help
Right.
the families feel comfortable when you have to make that next step.
It's a big decision.
It is.
It's a big decision. It's a really big decision. And the other good thing about Triology Home Healthcare is that we have a lot of specialty services. Having
We
been
do.
in this industry for years and years, I don't know that I've ever worked for someone that the company was that invested in trying to find niches to provide. Do you want to tell us about what
Well,
our nurses
actually,
do?
I know that we are definitely going to have to touch on our new program, which is our pelvic floor therapy.
So that's a very big deal. Last summer, we invested a lot of time and energy in training nurses and therapists from around the state to provide care to people that have pelvic floor dysfunction. So those are the muscles that support literally your abdominal organs. And what we've done is invest in something called biofeedback training. So with the use of simple electrodes that are placed on people, we can then teach them exercises so that they can strengthen the muscles of the pelvic floor and thereby reduce things like incontinence, which has been a big issue for
Yes.
a lot of folks. So that's been a
And
pretty
it's not,
special
and it's
thing.
not just urinary incontinence from
Right.
from our training. I also heard it was also fecal.
It's
and
fecal
gets
incontinence, right?
Yep.
Right.
Well, I think we're going to have a quick break.
We're going to have a quick break. Well, come back. We're at WNN 1470 AM and 95.3 FM.
Yep. And if you want to call in, it's 888-565-1470 if you have any questions for Colleen or myself.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP, the number 2.tv. Or call them at 1-866-224-5422. That's 866-224-5422.
You are listening to Tell Us Your Business, where our invited guests share all the knowledge of their business and how important it is what they do in our community. If you want to be part of the conversation, call into the show at 888-565-1470 and tell us what's on your mind. Now, back to Tell Us Your Business.
Oh, you're doing great.
Hello, Jackie. We're back. Hi, everyone out there in Radio Land. This is WNN 1470 AM, 95.3 FM, and you're talking to me, Colleen Farron, occupational therapist from Triology Home Healthcare, and Jackie Kelly, who's
I'm
one
a
of
home
our
health.
sales reps.
Yes, one of our home health coordinators.
The most fabulous.
Thank you. Thank you.
So everyone took a little break. You know, I was thinking as we were talking, you and I, that maybe we could talk a little bit more about painting the picture of what patients look like with home care, right?
Okay.
What comes to mind for me is an older adult, someone that has a sort of laundry list of chronic conditions. They're still very motivated to stay at home, but everything's just getting a little harder. It's a little bit slower, maybe a little forgetful. God, happens to all of us, right? I'll
Yes.
tell you. So what do you think that we have to offer that's the best for something like that, for that scenario?
Well, Colleen, let me think. Let me put my hands around this. So let's think about the older patient who's at home who doesn't realize that they are definitely a little bit slower getting up.
Maybe not so safe.
How about not so safe? It's taking a lot of effort to get out of the chair, right? Before you felt like you could put your legs down and you were feeling nice and comfortable and getting up.
Right.
There's a lot of little things with, let's say, just around the home.
Right.
Doing your, are you able to stand and do certain things in the kitchen? Are you able to see well? I know that one of our big occupational things are with the low vision.
Right.
So I would say with low vision would be something that I would definitely.
It's one of those conditions maybe that people have that had some heart failure. Maybe their kidneys aren't 100% anymore. Their vision. They could have diabetes.
Yes.
Right. That whole cluster of diseases limits people. Right. They are forgetful for their medication. Right. They may have a little swelling in their feet. And the doctor says, I really want you to take this water pill every day. And what happens when they take the water pill every day? They're up and down to the bathroom multiple times.
Right.
So they start saying, I'm not going to take that anymore. I think one of the most awesome things that our nurses do is our nurses are available to help guide people on the best ways to take medication so it doesn't interfere with them so much.
Absolutely.
Right?
The med management side of
Right,
it.
the medication management.
The medication,
Right.
which is very important,
Right.
especially, as you said, people just choose sometimes not to do it because it becomes an inconvenience.
That's exactly it.
And they don't want to feel like they have to do it. Sometimes it's nice to have a nurse come in, set everything up for you, walk you through it. A lot of times too, Colleen, as you know, we get to the home, and I know the nurses have multiple times have told me there's old medication.
Right.
There's medication that the hospital may have just sent them home
Especially after hospitalization.
Yeah,
You're right.
And
You're
they're
right,
confused.
Jackie.
They don't know which one to take. So
Right.
sometimes
Which dose? Right.
Sometimes they take both,
Right.
and that could be a danger. Just
Right.
having
Right.
an extra set of eyes and ears coming
Right.
in and looking and being able to walk them through that we need to discontinue one and start with the other.
Start with the other. I know the other thing our nurses do with medication is they do IVs in the home.
They do.
My own mother had that. She had a reaction to something. She went to the hospital. After a couple days, the physician and I agreed that she should come home, and for 14 days, Nurse Margaret came out and
That's
provided IV services, and she was lovely in the extreme. She was smart. My mother trusted her implicitly, and I think that Margaret was really helpful. She gave my mother sort of ambition.
Yes.
So it was great, and we worked in conjunction with remind me, an IV company.
Health First.
Health First.
Infusion.
Right.
One of
Delivered.
we work with
delivered
many
everything
of
to
them.
us.
We work
Right.
with Quorum. We work with all of them, but
Right.
I know Health First is
Right.
definitely a good one.
So
as well.
that was pretty good.
Yeah.
If I can continue, my mother has recently been diagnosed with Parkinson's disease. And
Oh,
one of
I'm
the first
sorry to
things
hear
I
that.
did, I know it's very mild. She's quite older, so I think that we will be able to manage this. But the first thing I did was I called for a physical therapist,
Yes.
right? So he's going to come into the home and do some really good exercise.
Which is going to help with strengthening her gait.
Strong.
Absolutely.
Very good.
Yes.
Right. So we have some really good services, lovely people.
Absolutely. And just going back to your mom in the IV situation, a lot of patients don't realize that you may have to stay in the hospital
Right.
or in a rehab,
Right.
and it's not your home. And if
Not
you're
your
able
home.
to get a home health agency like Triology Home Health Care that can do it in the home,
Right.
you get to be in your bed. You get to
Right.
have the nurse come to you and give you the IVs. Or depending on the medication, sometimes we help you set up with a pump.
Right.
So it just depends.
Right. So
But
it's a good alternative.
it is.
It's a really good alternative.
is.
Right.
Something else I'd like to add is our wound care nurse. That's another specialty of ours.
Right. And we see people with wounds for a variety of reasons.
Absolutely.
Right? They're surgical wounds, post surgery. We see people that have problems with foot wounds, leg wounds,
Tears.
all
Yes.
kinds of things. And so the nurses go out as often as needed. Sometimes they go twice a day.
They do.
And they do wound care. And they go many days in a row. They work closely with the wound care clinics.
Yes,
right?
and we're one of the few agencies I know. I can't even name another one off the top of my head that does wound vacs.
Right. Ah,
So
that's right.
A lot of our surgeons
Wound
and
vacs,
a lot of our
yes.
doctors appreciate that we take wound vac patients.
Right. Right.
So-
Which is a higher degree of expertise.
Yes.
And we have, the other thing we have is some of my favorite people are the certified wound care nurses,
Yes.
right? Really high degree
We
of training.
yes.
Yeah.
And I'll let you talk about that. We not just acquire
We
a
did.
wonderful WOCN.
From years and years that we've known.
Charmaine
Charmaine
Brooks.
is back, and she
Yep.
does a lot of teaching and training. She oversees the nurses that provide a lot of dailies and high intensity wound care. She knows the latest products. She knows how to get things done fast. And she really stays on top of her disciplines, literature, and research that's going on out there. Works closely with the doctors.
And doesn't she go all the way from Broward to Port St. Lucie
to the
to
Vero
Palm Beach
border.
to the Vero?
Almost up to Brevard.
Wow.
Yeah,
Wow.
she does. She does. She's a wealth of knowledge. And we actually have a WOCN as well on the other coast, Deb Wright, who covers from Naples all the way up as well. So
Wow.
we cover a big area. Yeah, so the wound care is pretty critical. So our nurses do IVs, they do wound care, they do medication management, they provide psychiatric counseling and services.
Right.
A lot of really good stuff. We have
for
social
programs,
workers, right?
community.
Right. Our rehab teams have some specialties as well, don't they? We have some certified vestibular physical therapists and occupational therapists, and
Yes.
those clinicians have a lot of background and training in what goes wrong when our inner ear crystals and some of the brain dysfunction occurs that make people lose their balance.
Is that like vertigo, Colleen?
Yes.
Yes.
No fun at all. Feels horrible, right?
No, and it's really there's no discrimination in age. I have
I
seen
know.
people in our my age range getting vertigo, and
Yes.
you had
Yeah,
vertigo
I
at one
did.
point. Did you?
I did. Yes, it's really the worst thing on the face of the earth. I was very happy to have a physical therapist who actually did the epily and put the crystals back in place for me, and we can provide those services in the home.
Yes.
And vestibular dysfunction also occurs when people have had strokes, they have MS, they have Parkinson's disease. We have clinicians that are certified in big and loud therapy, which is a type of Parkinson's therapy that helps to recalibrate the central nervous system that's lost its sense of what's normal in terms of movement and in terms of vocalizations and the quality of voice. So we have speech therapists that provide loud services, and we have occupational and physical therapists that provide big services. You mentioned earlier lymphedema therapy.
Yes.
Right? So
Yes.
certified lymphedema therapists that treat people that have dysfunction of their lymph system, and that can happen following trauma. That can happen following cancer treatment.
Right.
We can have primary and secondary diagnoses.
And I know that a lot of our therapists, they not only just go to the normal of wrapping, they do manual therapy.
They do a fair amount
and
of
I
manual
have to
therapy.
tell you, I've had many patients thank me because they can't take the compression.
Right.
So they really, they appreciate that our therapists will go out and do manual therapy and help with
Right.
the lymphedema.
Because lymphedema is a combination of things, right?
It is.
It's a combination of skincare, it's a combination of exercises, and a really light massage technique, much like an effleurage, that's what we would call it, that helps to move fluid through these cisterns that live inside the lymphatic system, and then wrapping or some sort of compression. And what you indicated were those people that have a lot of hypersensitivity. It's almost painful for them.
Yep.
So we need to get the fluid down before we can start wrapping them. Boy, we do a lot.
We do.
I love us.
Yes.
So we provide those services. We also have really well-trained orthopedic therapists.
We do.
Right? People
Yes.
come out following any kind of surgery to a joint.
Oh, and they follow the orthopedics protocol to the T. I know that we have a protocol book in every office.
Right.
I know
right.
Broward, we are very lucky to have such a great team of therapists.
As does Palm Beach.
Oh,
Same thing. right?
absolutely.
Actually, I have a spine specialist in this office in Palm Beach who's been in orthopedic spine for a long time. So she does some good stuff. Our occupational therapists do some counseling, some psychiatric services. We provide low vision
The low
therapy
vision.
for those people that have macular degeneration or glaucoma, that have diabetic eye disease.
So I wanted to find out, because this is a question that we get asked a lot out on the field. Patients want to know, how often can they expect the nurse or the therapist to come out?
Right. All depends on the patient.
Right.
So like Jackie and I indicated, and as you as well, Lisa, that some folks need twice daily care, 7 days a week. Other people need 3 visits a week if you've just come out of the hospital.
And I think they do that on the initial assessment.
They
is
do.
where
They
they
determine it,
really try
right.
to determine.
Right.
And if someone needs a little more in the front, we are more than happy to go
Right.
out and give you an extra visit in the front or 2, or get you nice
whole
and
week.
healthy. Yeah, we've
Yeah,
done it.
we
for
front load a
We
lot.
front load a lot. Make
Yeah.
sure that you're nice and strong, and we're getting you back to normal.
Right. So I think it depends on the patient,
Okay.
what
Thank
they
you.
need. You're welcome.
And how can the patient have services started? How can they get services started with
We have
us?
to have orders from physicians, which is one of the things we were talking about,
Yes.
right? Making sure we have those orders.
You want to make sure that not only does the physician understand the services that you're going to give them, their patients, you also want to make sure that they've seen the patient within a reasonable time frame. Sometimes the patients may want a service, but without seeing a physician, they need to go in and make sure he also does an assessment. That helps us figure out what the best plan is for
Right.
the patient.
The orders get faxed to the office.
They do.
We have an intake team that immediately reaches out to the family, to the patient, and says,
Yes.
we'd like to come out to see you.
Yep. And we
And
can
these-
always.
These teams are located in Broward County,
Broward County.
Fort Myers and Naples,
Right.
Jacksonville, Daytona Beach, St. Augustine, Ocala, Palm Beach, Pinellas, Port St. Lucie, Okeechobee, Vero Beach, and Sarasota.
Wow, we are just everywhere.
You're awesome.
Yes.
This was fun.
This was lots of fun.
Thank you.
Thanks,
I hope
Colleen.
you have a good night.
You too. Thank you.
You're listening to WNN 1470 AM and 95.3 FM.